When I saw this patient's labs, one value jumped out and I realized she doesn't know she's dying. There is a dangerous metabolic problem I see over and over again in women older than 50 and even younger in men. The symptoms elude the patient, meaning they don't feel a lot, but they have high blood pressure, they have fat that won't go away, and they're really aging faster than they should. The lab at the center of this warning is ferritin. Ferritin is the lab that teaches me how much iron your body is storing. Iron is an essential element in your body that is key for oxygen transport, DNA synthesis, and brain function. It is vital. When your body can, it stores extra iron for times where intake of iron might be low. Ferritin is the lab that we check to see how well your storage bins for iron are doing. If your ferritin is low, and I mean less than 50, it's a danger sign that you have not built up your storage bins, that your brain function and other parts of your body are at risk for not being able to perform correctly. This is not what this video is about. We are going to unpack what happens when that ferritin is greater than 200. First, the added iron storage is healthy, but it has long been known that excessive amounts of stored iron are signs of dying, that your body is aging faster than it should, and we should help you reverse that. If the storage gets too high, the environment that's holding the stored iron ages very rapidly. And most patients with elevated ferritin never know there's a problem until their storage unit, their liver, has dangerous, deadly problems like cirrhosis. We're going to start this story long before that. My patient and I both had an elevated ferritin, greater than 200. But the outcomes in her case are far more alarming than mine. Let me teach you the difference. Iron is a reactive metallic element that is required for our body. The key word there is it's reactive. Inside our bodies, extra iron doesn't just sit there, it reacts with parts of our body, specifically with oxygen. That oxygen reacting with the iron creates a free radical. These are harmful and we don't want them in our body. Idle iron mixes with oxygen and we make excessive amounts of these. Don't worry, your body has a mechanism to take care of a few of these. But if that reaction is happening over and over and over again, it floods the system with these harmful reactive oxygen species, or free radicals. That's a mouthful. I explain it to patients by saying their iron in excess is rusting, which is what happens when this iron sits around for too long. Over time, these free radicals damage things like the insides of your blood vessels, and it reacts with your LDL cholesterol, making it an oxidized LDL cholesterol. Excess rusting on the inside of blood vessels is called atherosclerosis. That's the hardening of your arteries that comes years before the first heart attack or stroke. Her ferritin is 300. Not quite normal, but more normal than mine. So why is hers causing a problem and mine isn't? Well, that's a subcellular answer that only shows up in these other labs. As that iron is rusting throughout the body, it starts to steal energy and create these free radicals. I can't measure the free radicals, but I can measure the grime or the inflammation that gets caused when they're in excess. The lab that shows up the soonest is a highly sensitive C-reactive protein. You'll notice that her C-reactive protein is 2, then up to 5, then 3.6, and you might think, that's not too bad. But it is a huge signal, especially at a young age, that there is an inflammatory grime happening at this subcellular level. Part of what is rusting her body is the excess iron. That might sound like a little, but that is a huge sign that a bunch of those naughty red oxygen molecules are damaging things at a rate that she can't keep up with. This is the rapidly aging process that she doesn't feel. Those naughty red oxygen molecules will convert her normal cholesterol into an oxidized cholesterol. Now, I can't measure that. I can only measure the labs that are associated with it, which include the ferritin and her C-reactive protein. The other warning sign is to look at average blood sugar. My average blood sugar over these past 2 years is about 100 or 103. Now, not as great as I'd like it, but not causing problems. In my patient, her average blood sugar was 115, 105, and then back up to 110. This, although slight, is a significant increase in the amount of burden it's putting on her body. The combination of measuring the GU, the C-reactive protein, and her ferritin, and then we're adding the measurement of the average blood sugar, which we know comes with an increased amount of insulin. It's this combination that teaches me her body is growing more and more inflammation on the insides of her blood vessels. And this is subtle. You can't feel this, folks. I don't get this from a history. I only get this from a lab profile. And I wasn't 100% confident until I measured her homocysteine. Homocysteine, this is a molecule in our bodies exclusively made from methionine, and it needs the help of iron to do that. But what makes homocysteine amazing is it's an independent marker of heart disease. This is a really key word. Independent marker means no matter what else is going on, when that homocysteine is high, you have major danger happening. Blood pressure is not an independent marker. LDL cholesterol is not an independent marker. Even hemoglobin A1C is not an independent marker of heart disease. But homocysteine is. So when it's abnormal, above 15 in a patient, pay attention. Look what happened to this patient. Her homocysteine was normal in 2002 at 10. But then, nearly a decade later, it's over 18. This makes me say, whoa, help this patient. There's danger here. How do I know that? Because the homocysteine's high and the ferritin has been high, along with that C-reactive protein. Again, it's this constellation of warning signals that we now have a triple check mark. There is a problem. This trifecta of labs does show me that her LDL cholesterol are being oxidized, and there is a brewing problem underway. So to fix this ferritin, I don't just tell her to go donate blood, drain out the blood and lower the ferritin. We must fix the underlying problem causing this chronic inflammation. And in her case, it was hard. It had to do with her sleep. Decades of poor sleep led to increased cortisol, which led to increased blood sugar, which was increased insulin and increased metabolic problems. And the cascade of problems resulted in a chronic inflammatory state that was aging her in a deadly way. Improving her sleep was the first step to lowering her blood sugars, which would decrease all of these stress chemistry markers. Over time, these steps lowering her inflammation and unoxidizing her LDL cholesterol backed her away from the cliff that she was about to step over. If you want to know the labs that I ordered immediately after I figured this out, check out this video. I'll see you there.